let me doing the opening first, and you can start your session, Karina. Okay. So, good evening, everyone in Indonesia. Tonight we will have talk or discussion about your perspective of mental health in United States of America. So we are having the guest here, and Karina has attended the session. So thank you, Karina, for agreeing having the session with us. And then, I'm getting nervous. Okay. Tonight we will have some discussion, and there are some questions also that we are provided, and maybe some of audience here will ask you. Of course, the session will be in Bahasa Indonesia and English. So during the session, we will switch from English maybe to Bahasa Indonesia, and then maybe from Bahasa Indonesia to English. Okay. So without further ado, you have 30 minutes to share your presentation.
Okay, good morning, everybody. So we will be discussing the youth perspective of mental health in the United States. Can everybody see this okay? Give me a thumbs up. Okay, good. So I wanted to start by giving you a background about me. I received my Bachelor's of Arts in Psychology from the California State University of Bakersfield. It's a kind of small school in a big state, but it was a good learning experience. I also have an associate's degree in communication. And while I was working on my bachelor's, I worked in behavioral development for children in something called applied behavioral analysis, based on psychology principles as well. Now I'm currently a molecular life sciences fellow at the University of Missouri. I'm getting my PhD in interdisciplinary neuroscience, and I do research on autism spectrum disorders, primarily using fMRI and behavioral measures. So that's a little bit about me and where I've come from and where I'm going. And I wanted to tell you now what will be covered in my talk here. So I want to explain my personal experience during the pandemic, common mental health issues in the United States prior to the pandemic, the racial disparities that already existed in mental health, and how cultural differences in mental health seeking behaviors exist in our country, and how COVID-19 has affected mental health across the board in general. So my personal experience, it's hard to even find a place to begin because it was so life-altering, but I was very pregnant in March 2020, and I remember thinking that there's not going to be anywhere that I'm going to be able to find clothes for my baby or wipes or diapers. And every time I went to the store, there would be nothing there to buy. And this quote at the top where it says, "Do you really need all those baby wipes?" is because I was in line and there was a man in front of me who had 32 packages of baby wipes as I'm standing there, obviously very pregnant. And I asked him, like, I really hope that you're going to put those to good use because there's not a single package left for me. And there was some serious concern as to whether or not I was going to have supplies when the baby came. So that was very stressful. Traditionally in America, we do baby showers where your family will come and get together and give you gifts for the baby before it's born. I didn't have that because it was too risky for my family. And California was one of the very serious states where they basically put you on lockdown. And they had military presence on the border so that there wasn't a lot of people traveling. And I remember when I used to go to work every single day, even while I was very pregnant. And I remember I was getting gas for my vehicle and I received a phone call saying, hey, don't bother coming today because I don't know when we're going to be able to work. And I don't know when we'll be able to do it again. It's indefinitely, don't come to work. And at 8 months pregnant, I was confused as to how I was going to make money or support my family or any of those things. And I ended up losing my apartment that I had and moving in with my mother. And that was actually a really good thing in the long run. It saved me money. And luckily I had already applied to PhD programs and I was getting accepted at that point. But I couldn't go visit the universities. Traditionally, you would go for an in-person interview and get to see the campus and the location, whereas this was not an option for me. But it was the only option I had because I had no job and they were offering a pretty substantial stipend. And I thought, you know what, it could be bad, it could be amazing, but at this point it's the only option. So I took it, and that's how I decided to start my PhD program here at the university. Now, since I've talked to you so much about being pregnant, giving birth was another very strange experience. I also was not allowed to have anybody there, to do it alone, which I would have at least liked to have had my mom, and they wouldn't let me leave my room. They tried to discharge my baby at one point prior to, they had already discharged me, and they were going to tell me that they weren't, like, a baby's not allowed to have any visitors. And I said, how can a baby who's like 2 days old not have a parent present? But then he fell off the bed a couple months later, and the same experience happened. So it was no different 3 months later. So, and then another very important aspect to my experience during the pandemic was the daily talk that Trump was giving, our president at the time. And I just remember being appalled and embarrassed at all of the horrible things that he was saying. And people were drinking hand sanitizer and bleach. And I mean, that sounds really ridiculous, but it's true, all because of what one person was saying. And me, as a person of science, I was astonished. So between the non-essential shopping stores being closed for no, baby materials, can't find baby wipes, losing my job, and then Trump, it was quite the ride. So I can say from my personal experience that it definitely was very trying on my mental health. So now we're going to talk about the common mental health issues of the United States youth. What are they predisposed to anyways prior to the pandemic? And that was depression, which is feelings of loneliness and worthlessness, not being able to get out of bed in the morning, debilitating sadness, really, and then anxiety, which is characterized by worry, extreme worry. It also has heart palpitations and things that are related to your parasympathetic system and overactivity of that. Eating disorders, which are characterized by eating too much or eating too little, or eating and throwing up. So that's really prone for people who are young in our country. And then ADHD, which is attention deficit hyperactivity disorder. That's characterized by compulsive behavior, high energy levels, and it's actually quite complex, but it can be kind of overdiagnosed. So those are the four main, but they said that the most common is anxiety. So in June 2020, the CDC release, which is the Center for Disease Control, said that 1 in 4 adults 18 to 24 have considered suicide. 68% said that they had very little energy. 59% say they have trouble sleeping. 49% with poor appetite. 48% trouble concentrating. 32 moving slowly or they're fidgety, and 28% had thoughts of self-harm. So those are all very characteristic of the diagnoses on the previous page. For example, trouble concentrating is very ADHD, whereas thoughts of self-harm can be depression. And these are higher than average numbers because in June 2020, we all know what was going on. There's also this really major concern within the US right now, and has been in the past, but it's more so in the light now because of COVID-19, and that's racial disparities in mental health. So I recently went to a talk and it was very informative, and what I learned was that white people in general are more likely to seek out health treatment, and that is for both physical health and mental health. And it has a lot to do with how our country has treated people of other races and other cultures historically, and also due to like cultural differences of attitudes towards medicine. So here's just a couple of notes about that members of minority groups have either lower or equivalent rates of mental health disorders compared to whites. American Indians are at a heightened risk for PTSD, which is post-traumatic stress disorder, and that can actually be culturally related. You can have cultural post-traumatic stress disorder that's caused by like racial anxiety and alcohol dependence, but they're at a lower risk for major depression. Also, African Americans are found to have substantially elevated rates of schizophrenia when compared to whites. Black people with schizophrenia are overrepresented in state psychiatric hospitals. Now that is very interesting, also very sad, because overrepresentation means that not only do they have higher rates of it, but they're unequally admitted to the psychiatric hospitals. And then African Americans have poor health outcomes compared to white Americans. And you can definitely see that with COVID because Black Americans have a predisposition for heart failure, and they tend to be have poor outcomes with COVID as well. But this is not something that's very well explained. They say that African Americans have poor health outcomes, but what they don't say is that historically, Black people in our country who would seek out health treatment would be mistreated, or they would be misinformed about their treatment. I don't know if any of you guys work with HeLa cells, but those come from Henrietta Lacks, which was a Black woman who had cervical cancer, whose tumor and basically her uterus was removed without her knowledge. And then there was things like the Tuskegee experiment, where they went around collecting data on Black American syphilis, but they didn't tell anybody that they had syphilis. So there's this concern that if you as a Black American go seek health treatment, that you will be misled or mistreated. And so there is a big fear of doctors and science, and it does create a rift. And there's also social economic status disparities. You know, with less money, you're less likely to seek healthcare. So those play a role in this as well. But among adults with diagnosed base need for mental health or substance abuse care, 37% are white, with only 22% of them being Latinos. 25% of African Americans receive treatment. And what this means is that, again, white people are being treated for substance abuse or mental health more so than anybody else. And based on the numbers, the Latinos and African Americans meet the criteria for underrepresentation, considering that they have higher substantial need for treatment. So what are the mental health effects related to COVID? So now that you have an understanding of where we were before the pandemic, this is where we are now. We have had an increase of 19% of people experiencing mental health issues, an increase of 0.15% more than the year before. 24% of adults with mental illness report an unmet need for treatment. The numbers are probably much higher, but that has a lot to do with sample bias and where these numbers are coming from. I could go into that, but it's okay. We'll do that later. 9% of youth in the US have severe or major depression. That's the highest among youth who identify as more than one race. So again, racial disparities. So you can see that it's higher with the 12.4% compared to the 9%. And 10% of Americans with mental illnesses are uninsured. This has increased for the first time since the passage of Affordable Care Act. And this means that people are going to be seeking out health treatment far less because of the fact that it costs money here. It's very expensive. So what have we seen? We've seen since COVID that 4 in 10 adults reported avoiding medical care because of concerns related to COVID-19. This is really interesting because it doesn't just apply to mental health, it applies to almost everything. My sister is a nurse in the emergency room center, and she told me that there's very rarely anybody sitting in there, whereas before you would have to wait hours because it was so impacted. Now there's nobody that's there. So things that were of minor concern are no longer being seen as urgent in American eyes. Now they're being like, oh, well, maybe this can wait, which is good. That's kind of a benefit because people with actual urgent needs are being seen faster. During late June of 2020, 40% of adults reported struggling with mental health or substance abuse. As you can imagine, people who already had a substance abuse problem or mental health abuse problem, when they went down for lockdown, they got worse. Statistically, their problems increased because they had less to do, less to focus on. And this also applies to spousal abuse and domestic abuse, which is like aggression towards marriage partners. If you're at home with an abusive partner, odds are it's going to go up if you've got nowhere to go. So there was an increased rate of abuse. However, theft and non-violent crimes did go down during the pandemic, which is kind of interesting, considering most businesses were unattended to. The pandemic was really rough on everybody's mental health. However, it did bring about some changes, for better or for worse, that might be around long term. I don't know how it's changed it for you in your country, but for us, Americans now have the option of a telecare health appointment, which means that instead of going into your doctor's office in person, you now have the option of doing it via Zoom or another method, which is really fantastic for people who have physical disabilities or maybe have social anxiety. So the telecare development has been really positive, I think, overall for everyone. And it's not just been managed in mental health, it's been utilized in academia and also in the workforce. COVID-19 has made us hyper aware of the need for social support and support resources. In a study, it was found that older adults who had stronger support were less likely to have severe COVID outcomes. So we now know that the more strong your social basis, your base is, then the more positive your mental health outcomes will be, as well as your physical health. Also, no longer needing a business front to run operations in person has decreased the cost of running a business, and having your employees work from home has increased the morale for employees and also their productivity. which is kind of interesting because I think that there was the original bias that, working from home would make people less productive. But I think that not being in a cubicle has been really positive overall for American mental health. And also now, before you go to the doctor, they now send you health screenings in your email, or they make you complete one over the phone. And that just means that they're checking to make sure that you're physically and mentally healthy before coming into a non-emergent doctor's appointment, which I think is very smart because it reduces the likelihood of you being contagious, being in a room full of other people waiting for a doctor's appointment. And then because of the Black American high death rate that we've had with COVID, we're hyper aware also of the racial inequities, which has increased the outreach for that particular cultural group. And essential care is now prioritized. Like I said, people with less urgent needs are seeking out care less often. So we're prioritizing the really important stuff. And that is my presentation. So I'm ready for questions if you have any.
Okay. It's really interesting to see your explanation, which include in PowerPoint, I mean. And then what concerns me that you have experience about dealing with COVID in the beginning with such situation. So what is the difference between the beginning of the pandemic and now? So how do you cope with that?
There is a huge difference compared to where we were at the beginning. I feel like life is very close to normal. I've adjusted to wearing a mask. I'm very good at, washing my hands now. And some things are just normal. These changes might be permanent for me. At the beginning, it was very difficult to adjust to, especially being home because I worked, I was very busy, I went to school, and then all of a sudden it stopped and I had to stay home. So I'm not one of those people who wanted to be home all the time. And now that has changed. Now I don't want to go anywhere. I'd rather be in my pajamas and my socks. So if we can do it through Zoom, I'm much happier, which would have been the complete opposite from before. So that personally has been the biggest change.
Okay, it's really interesting. Okay, now I need time to explain this to the audience, so you may wait for the questions. Okay, tadi Karina tuh banyak sekali cerita ya tentang pengalamannya dia semenjak COVID ini terjadi. Karena dia awal-awal tuh mengalami kehamilan, kemudian dia susah mencari stok untuk baby wipes or something like that ya. And then dia juga mengalami kehilangan pekerjaan gitu ya. Kemudian dia juga memutuskan untuk akhirnya sekolah lagi dan situationnya tuh dia harus move gitu tuh ke rumah orang tuanya gitu ya. Nah, datanya banyak sekali gitu ya, tapi yang akan saya highlight di sini adalah bagaimana penanganan mental health ini di US itu agak berbeda. Jadi ada isu rasnya gitu ya. Nah, ada kalau misalkan kalian ASEAN gitu akan ya chance-nya masih lebih banyak gitu ya dibandingkan dengan kalian kalau misalkan dari ras-ras tertentu yang lain ya. Tadi juga resiko kesehatannya ada yang berbeda, ada yang mengalami PTSD, tapi yang paling banyak itu adalah mengalami depresi, gitu ya. Sama seperti kita, mereka juga mengalami kecemasan yang berlebih, gitu ya. Dan wow, banyak sekali datanya dan sangat-sangat menarik, gitu ya. Karena ini diambil dari CDC langsung. Kemudian apa ya? Common health-nya tadi ada depresi, anxiety, ya, kecemasan, Kemudian ada perubahan pola makan ya, istilahnya eating disorders dan ADHD ya. Kemudian yang ditanganinya tuh mereka cepat juga gitu ya. Ada beberapa tahapannya gitu. Ketika kamu mengalami ya some people they are experiencing the difficulties gitu. Mereka juga mengalami kesulitan yang sama gitu ya. Untuk getting the healthcare, tapi mereka juga gercepnya tuh tanggap without delay. Tadi dibilang kayak gitu. Jadi kalau memang prioritas keadaannya, mereka langsung gitu ya. Kemudian kalau tahapannya untuk getting the psychological treatment gitu ya, atau misalkan kita mau counseling gitu. Nah, mereka harus ada tahapannya gitu ya, ada telecare, social support, dan lain-lain. Jadi kalau misalkan kalian masih punya pertanyaan nih atau rasa penasaran sama mental health yang ada di Amerika gitu ya, boleh silahkan kalian chat di kolom box and I will try my best to give your question gitu ya. Okay. There is a question from Hannah Anggraini. Hi Hannah. Hi Karina, I want to ask a question. Are there any local value that impact to mental health of American people?
Is there any local value? Is that correct?
Yes.
For social support or?
Okay, let me ask to her. Jadi Hannah boleh lebih spesifik? Di social supportnya atau memang di RAS atau apanya?
Social support.
Oke, di social support.
I don't know that anything has changed as far as social support availability goes, or I think that more people are just joining those groups that were there prior. So there were always my grandma, she went to a meeting for old ladies every week, and she had 13 people who would come before. Now she has 30. So that group always existed, but now more people come. So more people are reaching out for the services that were already there. So locally, I think that involvement, it's been improved. Although Americans aren't very neighborly. So, when you think social support, you might include like neighbors or acquaintances, but I don't think that has changed much. I think, we're still very secluded in our homes, other than the groups we reach out to specifically.
Okay. Harus ditranslate lagi atau enggak, Hana?
Oke, sudah cukup jelas. Thank you, Karina.
Oke, thank you. Oke, boleh silakan yang lain, silakan langsung diketik aja pertanyaannya di kolom chat, nanti saya akan bacakan ke Karina. Oke. Let me see from the guidance. Okay. So basically, do young people have a better access for, regarding this issue for this mental health? Is it they have higher awareness, or they just secluded, like you said before?
As far as the mental health awareness of young people, I don't know that they're very aware of their mental health, to be honest. Although I think that they are very aware of the impact that COVID has had on their lives and their mental health. But I think that because they're developing in this changing world, that maybe it's not like visually present to them. They're not recognizing necessarily like the change in their mental health. All they know is that, they feel worse this year than they felt last year. But as far as them like having an idea of how the mental health is of people their age in general, I don't know that they're very aware of that. No. Yeah, I don't think so.
Okay. Jadi young people-nya masih sama lah ya kayak di kita gitu. Jadi mereka tahu apa yang terjadi, tapi mereka juga nggak terlalu mendalami gitu ya. Apa sih yang terjadi gitu? Mereka hanya tahu bahwa ada yang berbeda gitu loh dari tahun kemarin gitu, atau secara kehidupan tuh seperti itu. Karena mereka juga masih terus mencari gitu, terus berkembang gitu. Oke. So how does government provide mental health care system besides the telecare and the health screening?
The government in America does not provide healthcare. Healthcare is privately operated, and we have to have insurance to be able to utilize health services. Otherwise, we pay at full cost, and full cost is very, very expensive. So what happens is people who cannot afford healthcare get left behind by this system. And unfortunately, the people who can't afford healthcare are some of the most in need, which is why America has tried to pass healthcare acts, but it is not widely wanted or accepted. And even if people with socioeconomic barriers had healthcare opportunities, they're still less likely to receive care or seek care because of prior cultural learning histories with the healthcare system we have. So I don't know if that answers your question or not, but as far as government involvement, I would say there's not much. It's very much up to you as the individual to seek it out if you are in need.
Okay, so because I asked this question because I'm curious, because when I read some documents maybe on the internet that said the healthcare system in America is different from ours like that, and then I do not completely understand how does it work.
Yeah, our healthcare system is very bad, very bad. It's upsetting how bad it is, and the infrastructure is so embedded that it would be very hard to remove or to change without severe resistance. And unfortunately, mental health care is a part of medical health care. I don't necessarily think that it should be because of the cost issues involved. I'm one of the few Americans who don't believe that we should have to pay for healthcare. I think it should be free to everyone, but
Yes.
that is not a common thought or opinion in my country.
Okay, I get it. Nah, jadi guys ya, kalau misalkan di Amerika tuh sistem kesehatannya berbeda gitu ya. Kalau di kita tuh ada BPJS kayak gitu. Nah, mereka tuh harus bayar full secara, kalau mau dapetin akses kesehatan kayak gini, mereka harus bayar asuransi. Nah, asuransi ini dikelola bukan dari pemerintahan, tapi memang dari swasta gitu ya. Kalau kamu punya uang, kamu bisa dapat fasilitas kesehatan yang kalian mau gitu ya. Tapi kalau enggak, ya udah ditinggalin kayak gitu aja. Makanya agak-agak sulit gitu ya kalau di sana gitu. Boleh silakan yang mau nanya ini aja di kolom chat, jangan malu-malu ya. Jadi saya juga bisa nanya gitu ya ke Karina gitu ya.
Please,
Yes.
aku mau nanya, nanti tolong translate. Hi Karina, I want to asking but in my language, so Risma can switch for translate. Risma, ini menarik ya. Jadi tadi disampaikan kalau misalnya mereka itu untuk fasilitas kesehatannya nggak di cover sama pemerintah gitu. Kalau misalnya kayak gitu sebetulnya berarti mereka untuk bisa menjaga kesehatan mentalnya, apakah pemerintahnya, kan kalau di Australia itu kita punya mereka tuh bilang, kalau temanku yang di Australia itu bilang ada kementerian tentang kesehatan mental gitu. Jadi memang pemerintahnya itu menyediakan untuk si kesehatan mental. Nah, kalau Amerika, apalagi dia disebut dengan negara yang sangat maju, apakah ada si kementerian ini atau misalnya yang benar-benar khusus pemerintah mengcover untuk kesehatan mental, baik misalnya lah dari lansia, orang yang depresi. Kalau di kita kan kayaknya orang dengan gangguan jiwa masih terlantar di jalanan. Nah, kalau misalnya di Amerika tuh kayak gimana sih? Gitu ya, Riz ya?
Ya.
Thank you.
Thank you, Teh Sifat. Bentar, ini agak-agak panjang. Jadi saya harus gercep dulu nih. Apa inti
Semangat.
pertanyaannya? Oke. Oke, Karina, so do you still hear me? Okay. Sifat asked you actually about with such condition where government doesn't involve in healthcare system, how people who in needs for getting psychological treatment, I mean for depression, for PTSD, or any other else in mental health issue. So how do they get professional help?
That is an excellent question. I don't know that I have the answer because it is a problem. It is an ongoing existing problem that is not being remedied. Other than outreach programs where people who are in mental health or in some sort of other capacity unless they go to those really in need communities, those are called the outreach programs. That's why I mentioned those. Unless they go to the communities, sometimes the communities will never go to them. Unfortunately, they don't or won't get treatment. And even if they do, or even if some went, there's more people who would not go. There's less people who would be open to the idea. They're met with a lot of resistance, both within their kind of cultural dynamics and the way that they look at mental health, and also the barriers. So how do they get it? Like I said, it's very self-driven. Either you recognize that there's an issue and you seek it out, or maybe a family member brings you to a facility or to a doctor with encouragement. But I don't know that I have the answer because it's not a perfect system. It's very messed up here.
Okay, I can see. Nah, jadi teman-teman kalau misalkan di Amerika itu untuk seeking help ya, istilahnya untuk mencari bantuan di urusan kesehatan mental ini juga agak sulit. Jadi keterbukaannya juga sama, masih agak-agak tertutup gitu ya. Ketika ini tuh bagi di warga sana juga menjadi masalah yang sedang terjadi gitu ya, and how they do not know how to solve it gitu. Bagaimana menyelesaikan hal ini, karena ini terkaitnya tuh banyak gitu, selain sistemik gitu ya, sosial juga, cultural dan lain-lain gitu ya. Kemudian mereka itu kalau mau cari helpnya gimana? Datang ke komunitas gitu ya. Nah, sayangnya komunitas ini tidak merangkul gitu. Mereka harus yang datang gitu. Dan ini juga mereka tuh enggak langsung misal, oh saya punya mental health issues dan mereka datang gitu, enggak gitu ya. Jadi ini juga harus disupport, sama lah sama kayak kita ya. Kalau misalkan anggota keluarga kita aware, ya datang gitu ya. Kalau enggak, I don't know what happens gitu. Oke, silakan ada lagi.
I will say one thing though, that topic is something that is being researched. They're trying to figure out how to make it better. And they're also trying to teach children from the time that they're young that having mental health care is a positive thing. They're trying to frame it in a light that kids can develop this positive association so that when they're adults, they're more likely to seek it out. So, I mean, there's no systematic thing in place that is governed currently, but there are programs and people who are trying to make a difference. It's just going to take a long time.
Oke, jadi ini juga masih dalam penelitian gitu ya, hal ini gitu. Kayak gimana caranya misalkan nanti ketika anak-anak itu lebih di apa ya namanya ya, apa Teh Sifat bisa dibantu nggak ya? Maksudnya tuh lebih dipersiapkan gitu. Kalau misalkan anak-anak ini bisa menghadapi ketika dia dewasa gitu.
Dibekali maksudnya, dibekali kayaknya dibekali mungkin dengan berbagai macam skill, kemudian juga knowledge ya tentang si mental health ini. Nah ini menarik lagi nih, saya pengen nanya lagi. Menarik. I want to ask again, Karina. Risma, jadi gini, yang cukup menarik adalah kan si Amerika ini negara yang benar-benar maju ya. Sebetulnya pendidikan kesehatan mental kan kalau di Amerika tuh anak-anak tuh udah diajarkan tentang sex education gitu ya. Nah, kalau misalnya tentang si kesehatan mental itu sebenarnya ada nggak sih di mata pelajaran anak-anak sekolah di sana gitu. Jadi memang sudah dikasih nih pembekalan atau pengetahuan tentang kamu nggak boleh bully, kamu nggak boleh shaming ke orang dan lain sebagainya. Kayak isu itu kayaknya berkembang banget di negara-negara, hampir semua negara dan dialami banyak kalangan ya kayaknya.
Dulu teh, aku
Semangat,
agak-agak perlu waktu nih. Ini yang mau Teteh tanyain, dengan sistem pendidikan yang seperti itu, gimana caranya di medical care?
Aku pengen nanya di Amerika sendiri, apakah sistem pendidikannya di apa ya? Ada mata pelajaran atau misalnya ada kelas yang khusus untuk membahas tentang kesehatan mental supaya anak-anaknya tuh nggak ngebully orang, nggak body shaming ke orang. Nah itu ada nggak sih sebetulnya? Kan sebenarnya itu bisa jadi support group buat young people yang ada di sana.
Oke, sip. Nah, ini lebih jelas. Oke, Teh. Okay, the question is there any course or classes for prevention, I mean for the kids to understand about bullying, body shaming, or anything related to how people interact each other? That's the question, Karina.
So again, good question. Because I do believe that they should have psychology courses embedded in the curriculum for elementary students. So, you know, those really important critical years between like 6 and 12. But there's not really any official learning criteria for how to teach kids to be psychologically aware or being aware of mental health. I think now teachers are trying to educate kids on it, but they're not obligated to. It's not part of the official curriculum. So I think that they have people who come in and talk to kids about bullying, and they read them stories and things like that, and body shaming and things like that. But there is not any official capacity telling them that they have to teach them that. I think it is normal now to have it kind of embedded in the material sort of by the teacher. But the government isn't saying, hey, teachers, teach our kids about positive mental thoughts and, self-awareness. Like they're not doing that. I think they should. I think that would be a really positive thing to do, especially because there's a stigma around mental health care and having mental health problems. In America, like if you were to tell somebody that you had a heart condition that you took medicine for every day, people wouldn't think twice about it. But if you told them that you were on antipsychotics for schizophrenia or depression, then people would kind of think of you poorly. And so by teaching kids how to think about that less of a negative way, I think that could have some really positive outcomes on people seeking treatment in the future. But no, they're not doing that. I wish they did, but unfortunately, no. So.
Thank you, Karina.
It's really interesting, really, really interesting. Okay. Okay, is there anyone who wants to ask another question, maybe? Okay. Boleh, silakan yang lain. Sebentar. Oke, ada pertanyaan ya di kolom chat ini ya. Oke, tar dulu bentar deh. Okay, this is interesting. The questions, yeah. The question is from Dea, and then she reads a journal actually, which stated that a vaccine has effect on mental health. Maybe if you have the capacity, you can explain this to her.
Is she talking about the COVID-19 vaccine?
Yes.
Okay. I don't know. I haven't read that article, so I can't speak to it. I don't know of any mental health effects, but that would be interesting to read about. I honestly don't know. However, I would think that the overall outcome of saving people's lives outweighs the potentially negative impacts on mental health. So that would be my take.
Oke, jadi Dea itu jawabannya ya. Jadi karena dia belum baca, jadi dia nggak bisa menjawab pertanyaan tersebut gitu. Tapi menurut dia itu juga menarik gitu ya. Kalau itu ada impact-nya gitu, ada pengaruhnya untuk orang lain dan itu akan lebih mencegah gitu. Itu ya mungkin bisa saja gitu ya. Nah, so in your opinion, what should be done as a young person so that mental health awareness is increased?
As a young person, I don't think it's their responsibility to increase awareness. I think it is our culture in general, the population at whole, who should be responsible for that. We should be implementing psychological awareness and positive mental health to our youth. They should be looking to us as models of positive mental health. I wouldn't put responsibility on a young person because I don't know that there would be much good that would come of that. I think that it would be nice to see young people reaching out and being a part of those organizations, but I wouldn't expect them to be the heads of those types of movements. So,
okay.
But I would say the best thing that they could do is to be involved in those types of things. We have like walks for mental health awareness. We have like charities and organizations they could join. And if they want to be models of their peer group, that would be a positive impact they could have. But I wouldn't, like I said, I wouldn't put the weight of the whole responsibility on them.
Okay, understandable. Jadi teman-teman, jadi menurut Karina itu tidak seharusnya beban itu ada di tanggung jawab sebagai orang-orang yang kita muda gitu ya. Tapi istilahnya ini ada tanggung jawab juga secara culture gitu, budaya gitu ya. Kemudian apa yang bisa kita lakukan sebagai orang-orang yang lebih muda gitu ya. Ini tuh bentar, saya mikir dulu. Oke, jadi mereka bisa saja terlibatnya tuh dengan cara yang lain gitu, boleh dengan charity gitu ya, istilahnya terlibat gerakan kemanusiaan dan lain-lain, tapi tidak akan membebani tugas yang berat ini nih hanya kepada generasi muda kayak gitu. Ada yang lain? Tesifat, is it?
Aku aman ya, yang lain dong gantian. Nanti kamu susah lagi translate-nya kalau aku yang nanya.
Sesuatu wajar ya. Coba yang lain boleh kalau mau tanya-tanya ya sama Karina, boleh silahkan ketik aja, nggak apa-apa. Kalau misalkan malu di kolom chat ini yang everyone ya, misalnya yang di tempat umum boleh lah ya, DM aja tuh ya di chat gitu, boleh silakan. Sambil kita nunggu. Menarik banget ya ini diskusinya. Iya bentar. Okay, so I guess we would like to sum up our discussion today. So do you have something to say
In
to our
summary,
audience for the closing?
I would say that overall, the pandemic has been a life and world-changing event. And I don't know that we'll ever get back to where we were before. But we have an acute awareness of mental health now that we didn't have before. And I think that that is a positive thing to have. And I'm glad that we have it. And I'm sad that it had to come at a cost so great. But nonetheless, here we are. And so let's hopefully positively move forward and take the knowledge that we've gained and put it to good use.
Oke, jadi terima keadaan yang sudah terjadi saat ini dan kita harus bisa berpikir ke depannya gimana gitu ya. Itu yang dikatakan oleh Karina gitu ya. So I guess that's all for our session. Thank you Karina once again for doing the session. Good morning and have a good day.
Well, good night and thank you for having me.
Okay.
Okay. So Karina, maybe we can take a picture, together.
First.
Okay.
Oke.
Stop recording
Yang
dulu ya.
lainnya boleh dinyalakan kameranya. Oke.